Okay, so breastfeeding or formula feeding. It seems like one of the first really big choices new parents face.
Definitely.
But when you start looking into it, wow, there's just a ton of information out there, so much advice. Honestly, it can feel a bit overwhelming.
It really can. Everyone seems to have an opinion, and sifting through all the studies and recommendations, it can leave families feeling more confused than anything.
Exactly. We've been looking at some really helpful info from health organizations, things aimed right at parents.
Mm.
And we want to kind of distill it, cut through the noise and give you a clearer picture of the core differences, the actual benefits.
Sort of extracting the key nutrients of information, if you will.
Hmm.
The goal isn't to say do this or do that.
No, absolutely not.
It's about providing a solid base of understanding so you can make that personal choice feeling more informed.
And it gets really fascinating when you look beyond just like the vitamins and minerals. We're going to touch on some interesting biological stuff, relational aspects too.
Yeah, there's a lot there.
Okay, so let's dive in. Where's a good place to start making sense of all this?
Well, I think a logical first step is just acknowledging the general consensus from, the medical world. What's the broad expert guidance?
Right. And what you see pretty consistently from major health groups is a strong encouragement towards breastfeeding.
Yeah.
That is, unless there's a specific medical reason preventing it,
Mm-hmm.
they really emphasize that while, look, the final decision is absolutely up to the parents.
Of course.
Breastfeeding is generally viewed as having some significant health upsides for both the baby and, interestingly, the mother's connection.
That's a really important frame. It respects the expert view, which is, built on a lot of research, but also keeps the focus on it being a personal family decision.
Exactly.
And like we'll get into, there's quite a bit of science backing up that encouragement.
Definitely. But that phrase, unless there's a medical reason not to, that's key, isn't it? What kind of things are we talking about there?
Yeah, good point. There are definitely situations where breastfeeding might not be possible or maybe not the best option.
Like what?
Well, it could be certain illnesses the mother has or maybe medications she needs that could pass into the milk. Sometimes a mother might struggle to produce enough milk.
Okay.
In those cases, it's just so important to talk openly with doctors, with lactation consultants. They can give tailored advice, maybe discuss supplementing with formula.
And it's worth remembering, right, that even if exclusive breastfeeding isn't in the cards, sometimes even a little bit of breast milk can still offer some real benefit.
Oh, absolutely. That's a great point. Even partial breastfeeding can provide valuable things, particularly those immune components we'll talk more about.
Okay.
So maybe to really get into the nitty-gritty, we should compare them side by side. Look at breastfeeding versus formula across a few key areas.
Yeah, let's do that. Let's break it down. How about nutrition first? What are the main differences there?
Okay, nutrition. Breast milk is often described as having this perfect balance of nutrients. And crucially, they're really easy for the baby to absorb.
Easy absorption. Okay.
But what's kind of amazing is that it's not static. The composition of breast milk actually changes. It adapts as the baby grows, meeting their specific needs at different points.
Wow.
Plus, the baby tends to naturally regulate how much they drink. It's like this living, evolving food source that we're frankly still learning about.
A customized meal plan that changes on the fly. That's incredible. How does formula stack up against that?
So formula is meticulously engineered to be nutritionally complete. It provides high levels of all the known essential nutrients.
Right.
But the absorption might not be quite as efficient as with breast milk. And there's always the human element in preparation, getting that powder to water ratio just right.
Good point.
Plus, some babies might be sensitive or react poorly to certain ingredients. And maybe the biggest thing is, like you said, science hasn't fully cracked the code on breast milk yet. All those components, how they interact, formula just can't replicate all that unknown complexity.
Yeah, those unknowns really highlight how unique breast milk is.
Oh.
Okay, let's shift gears. Cost. That's a huge factor for many families.
Oh, absolutely huge. Breast milk itself is, essentially free. Now, you might have some costs, nursing pads, maybe some nursing bras, potentially a breast pump if needed.
Right. Optional costs.
Formula, though, that's a consistent monthly expense, and it can vary quite a bit, The info we looked at suggested anywhere from, say, $50 up to nearly $200 a month.
Wow, that's a big range.
Yeah. And then you've got the bottles, the nipples, those are recurring costs, too.
That difference adds up fast, especially over 12 months. Okay, advantages. Let's look at the pros for each. What are the key benefits of breastfeeding?
So breastfeeding has quite a list. For the baby, the milk's always the right temperature, always ready to go wherever you are. Super convenient. And crucially, as we mentioned, it has these immunoglobulins. Think of them as like uh, borrowed bodyguards for the baby's immune system, especially early on.
Passive immunity.
Exactly, passive immunity. Giving the baby a temporary shield against things the mother has already encountered. And then there's the closeness, that skin-to-skin contact, and the release of oxytocin in the mother. That's huge for bonding. So it's not just feeding, it's triggering this whole hormonal response that deepens that connection.
That oxytocin connection is powerful. Okay, what about formula? What are its advantages? It's not just a backup plan, right?
No, definitely not. Formula feeding has its own clear pluses. A really practical one is flexibility. Anyone can feed the baby.
Yeah.
Dad, grandma, another caregiver.
Sharing the load.
Exactly. Which can be a massive help. And initially, there's no prep time like pumping, though you do have the warming and mixing later on. But that flexibility can be a game changer for some families.
Okay, so pros for both. Let's flip it. What about the downsides or challenges? Starting with breastfeeding.
Well, a big one for breastfeeding is the mother's availability, especially early on. If she's away, she needs to have pumped milk ready.
Right.
There can also be some physical discomfort sometimes, particularly in the beginning while figuring out the latch. Certain medications might be off limits. And missing a feed can lead to engorgement, which can be really uncomfortable.
I've heard those first few weeks can be tough, learning the latch and all that.
Yeah.
Is there advice on getting through that?
Yeah, the materials really stress getting support. Lactation consultants can be invaluable for helping with positioning, latch techniques, just troubleshooting those early hurdles makes a big difference.
Okay. And the disadvantages of formula feeding.
With formula, there's always that prep time, warming it up, mixing it correctly. Some babies, as we said, might not tolerate a specific formula well, leading to gas or tummy issues. Yeah. A major difference is the lack of those immunoglobulins we talked about. No passive immunity transfer. You also have to lug supplies around bottles, formula, water when you go out. And there's the possibility, though rare, of formula recalls, which causes understandable anxiety.
That lack of immunoglobulins keeps popping up. Can you explain a bit more how that passive immunity actually works? How does it protect the baby?
Sure. So a newborn's immune system is still, under construction. It's immature. Passive immunity is like getting a temporary loan of protection from mom.
Okay.
Through breast milk, the mother passes on these specialized proteins, antibodies called immunoglobulins, that her own body has made in response to germs she's encountered.
Ah, I see.
These antibodies give the baby short-term protection against those specific bugs. It's like giving the baby a temporary starter kit for fighting infections.
So the baby is borrowing mom's immune library, essentially.
That's a great way to put it. And it's not just antibodies. Breast milk also has other cool stuff, prebiotics to help good gut bacteria grow, enzymes for digestion, things that help the baby's gut lining mature, antimicrobial proteins, even mom's white blood cells.
Wow.
It all adds up to why breastfed babies often tend to have fewer infections and maybe better digestion.
It sounds incredibly complex and sophisticated. You also mentioned oxytocin and bonding. Tell me more about that. That's the love hormone, right?
Exactly. It's often called that. It plays a huge role. First, it triggers the milk letdown reflex.
Yeah.
But just as importantly, it fosters that deep emotional connection.
Wow.
Well, the physical act of breastfeeding, the closeness, the skin on skin, triggers a big release of oxytocin in the mother's brain.
Okay.
And this oxytocin surge is linked to feeling more bonded, more affectionate towards the baby. It also helps the mother feel calmer, less stressed. So breastfeeding isn't just nutrition. It's actively firing up the bonding circuits physiologically.
That's fascinating, that biological underpinning of the bond. Moving beyond the immediate stuff, what about long-term health? What does the research say about links between feeding method and health later on for both kid and mom?
Yeah, there's a growing pile of research here. Health organizations point to studies showing that for babies, breastfeeding is associated with a lower risk of developing things like type 2 diabetes later in life, asthma, obesity, also fewer ear infections, respiratory infections, and even a reduced risk of SID, sudden infant death syndrome. Those are pretty significant potential long-term protections.
Definitely. And what about for the mothers?
For moms, the research suggests breastfeeding can lower their own long-term risk of type 2 diabetes too. Also, certain cancers, specifically ovarian and breast cancer, and potentially heart disease down the road.
So it really reinforces that idea we hear sometimes that it's less of a lifestyle choice and more of like a health investment for both.
Precisely. The ripple effects seem to extend well beyond just those early months of feeding.
This has been incredibly clarifying. So thinking about wrapping up, what are the absolute must-know takeaways for someone trying to weigh this decision?
I think the key points are: breastfeeding offers this really unique combination of benefits nutrition that adapts, that crucial early immune support, and that powerful hormonal boost for bonding.
Right.
Formula is a really important and effective alternative, absolutely vital when breastfeeding isn't possible or chosen. It offers flexibility, lets others participate directly in feeding,
Mhm.
but it's good to be aware of the differences, the cost, the preparation, and the fact that it doesn't provide that passive immunity.
And like we said at the start, it's not about crowning one winner.
Not at all. The best choice is so personal. It depends entirely on the family situation, any medical factors, and ultimately what feels right and sustainable for the parents after considering the info.
So when you really take it all in, the nutrition, yes, but also these biological connections, the immune factors, the bonding hormones, it definitely gives you a richer perspective on what's involved in this very fundamental choice. It makes you think, doesn't it? How might you, listening now, view that deep link between health, immunity, and bonding in early life differently? Definitely something to reflect on.